football is having reduction in numbers of youngsters playing tackle football and increased numbers of youngsters playing flag football that I totally support 100%. I want all kids active, I want all kids in sports. But I think bashing heads is not a good idea for a lot of reasons. And for a number of reasons, kids are at greater risk in terms of their myelination is less than in adults. This is like coating of a telephone wire. It helps transmission, but it also gives you greater strength and less chance for the fibers to be torn apart. Brains are more at risk for dysautoregulation, excitotoxic shock syndrome that goes with second impact syndrome. Weak necks make that head a bobblehead affair, so that both when the head is hit or when your body falls down, your neck being weak, your head's going to be accelerated much more than if you had a much more developed neck. And there are issues with equipment. In some instances, youngsters not communicating well what their symptoms are, level of expertise at the coaching level, and of course, most youngsters age 5 playing tackle football, I would submit, have not truly had informed consent about what they might be subjecting themselves to when they become adults. Also, between the ages of 9 and 12, a lot of developmental things occur in the brain that places the brain at greater risk during that period of time, both with regard to metabolic activity, pruning of cells, and connectivity of cells. And there is a plethora of research to suggest that the developing brain is more vulnerable to poor outcome after traumatic brain injury. The recovery rates are longer in youngsters. They may have altered trajectory of both their emotional as well as their cognitive adult projected outcomes. And there have been 4 papers now since the Center for the Study of Traumatic Encephalopathy has been started that address this issue, the relationship between the age of first exposure to tackle football and later life behavior, cognitive, and mood issues. First paper was in March of 2014, and it showed that if you started playing tackle football under the age of 12, that you had a greater chance for behavioral, cognitive, and mood issues as an adult. And this was essentially giving these people that play football under 12, over 12, a large battery of neuropsychological, cognitive, behavioral, and mood tests and comparing them. So this was the first study back in 2014 to show a relation. In neurology in 2015, Julie Stam, with a separate group of people, basically found the same thing, that playing tackle football under 12 had a greater chance for cognitive issues as compared with people that started playing football at a later age. And then in 2017, Michael Lasko presented the first of 2 papers that pretty much showed the same thing. This was comparing a group of amateur and professional players, and it showed that the chances of impairment with behavior, impulsivity, depression, apathy, and executive function was greater if you started playing under the age of 12 compared with individuals that started football before the age of 12. And then last year, in a different paper looking at CTE, but symptomatology of CTE, Mike found a similar situation. That is, that if you started playing football, tackle football, under the age of 12, you had a 13-year, in this particular series, of 211 brains, 13-year earlier onset of cognitive, behavioral, and mood symptoms as compared with individuals that started later. So a fourth paper showing, once again, greater chance. There are also papers that have come out of the center that shows that connectivity, that if you started playing football under the age of 12, you had a greater chance for diffusion tensor imaging, regulation in the anterior portion of the corpus callosum as compared with people that started football later. And another paper showed that if you started under the age of 12, you had a greater chance for thalamic volume being smaller than if people started football after the age of 12. It is kind of fun to think that 2012 is when we kind of stuck our neck out and have taken a lot of grief, so to speak, for our stance. But it was just 3 weeks ago that the Aspen Society put out a publication that came out of a meeting they held in Washington, D.C., in which they had a number of speakers. And we were happy to participate, but just one of a small number, in which the Aspen Society raised the issue of flag football before the age of high school. And when we talk about flag football before high school, we're not talking about not playing football. We're talking about hopefully more people playing football. We're just talking about playing football in a safer manner without the head trauma. And for those that would argue that if you don't play before high school, you won't go on to a fine college career, or you won't be able to play at an even higher level, I think that's, number one, there's no evidence to suggest there's increased risk starting football in high school. Number two, even if you didn't play tackle before high school, we're not saying you can't learn to tackle. You can learn to tackle tackling mannequins, tackling dummies, just not tackling other people's heads. But these are just some of the football players that played in the National Football League that didn't play in high school in the backfield, and Jim Brown, Walter Payton, John Mackey's not too shabby. And our own Tom Brady at quarterback is pretty good. There are also many on the defensive side of the ball that did not play prior to high school. So I'd like to kind of close this up with maybe 6 takeaway messages that we have learned through the years about concussion, and then I really, from my personal standpoint, most welcome the question and answer part, which will come later. But first, when diagnosing a concussion, other than observing somebody being unconscious, the more tools you use, the greater the sensitivity you will have of diagnosing concussion. And if you use a tool that is only assessing cognitive function, like cognitive tests, which is primarily neuropsychological testing, whether on a computer or not, you're not going to be 100% accurate in diagnosing concussion. You'll probably be 60 to 70% accurate. And if you use tests that check eye tracking alone, you will miss some concussions that have cognitive issues, or just cognitive issues, or have just balance issues. And so if you check just balance alone, you'll miss some people that obviously have just cognitive or eye tracking. So the more tools you use, the better you're going to be at diagnosing concussion. Secondly, it's not just a metabolic injury, it's a structural injury as well. And we've shown you several papers that really, going back to the 1800s, should have tipped us on to that.